more updates as the games go on. But as I told you earlier on, virologist Professor Julius Oyugi will be joining me in a bit to speak about the COVID-19 trends across the world and the vaccine uptake. But first, Kenya is still struggling with the uptake of the COVID-19 vaccine, even as experts warn the slow rollout would in turn hamper the country's economic recovery until the year 2024. By the end of this week, some doses delivered to the country weeks ago from Denmark will expire, complicating matters in the fight against COVID-19. Now here's KTN's Chebet Birir with the COVID latest numbers in the country.
The COVID-19 vaccination process in Africa is proving to face many challenges, such as hesitancy to get the vaccine and lack of funds. Such problems have prompted some nations to donate some of their doses to help salvage the situation elsewhere. Kenya is one of the beneficiaries of these donations. In June this year, about 300,000 doses arrived from Denmark and were instrumental in vaccinating Kenyans. However, these doses are due to expire this week on the 31st of July. 625,333 Kenyans have received a second dose of the vaccine, with more than 1 million receiving the first dose. This is a sign that there will be a shortage of the vaccines, as a large percentage of the doses received in the country have already been used. The Ministry of Health has promised that the private sector will be involved in the supply of vaccines. However, the Secretary General of the Kenya Association of Private Hospitals says there have been several challenges.
I don't think there's necessarily been a comprehensive framework for engaging the private sector, both in terms of supply and in terms of distribution. There's still a lot of redundant capacity in as far as, for example, in the facility I work at, we've been out vaccines for a week, where we've got people coming in for their second doses and we don't have supply. And there's no clear communication as to what the challenges are or when to expect vaccine. So you see, for us as private sector, we get concerned, and because we also don't want to disappoint our clients.
Dr. Timothy adds that if Kenyans are to get full protection from the virus, the government should seek other alternatives.
If we continue to roll it out at the rates that we have, then achieving that herd immunity, which is what we are targeting, might be a challenge. Because if, for example, we're not even fully vaccinated, so that's one challenge in terms of access. I know there are also concerns about vaccine hesitancy, but I think you can only talk about hesitancy if the supply is actually available. You cannot assess whether people actually need the vaccine or not if it's in short supply.
With low vaccination uptake in the country, COVID-19 cases are on the rise in Nairobi County. Over the past 10 days, 2,800 cases have been recorded as the number of infections continues to rise. On the other hand, infections in the 13 counties where the government imposed a lockdown appear to be reducing. Over the last 24 hours, Kenya has recorded 664 new infections out of a sample size of 5,432. This is a positivity rate of 12.2%. Unfortunately, 16 new deaths from the disease have been recorded, bringing the total number of deaths to 3,865. 1,281 people are currently admitted in various hospitals across the country, while 3,683 are on home-based care. 170 patients are currently fighting for their lives in different ICU facilities. Chebet Birir, KTN News.
Thank you very much, Chebet, for that update on COVID-19 in the last 2 months. Now, like I told you earlier on, I have Professor Julius Oyugi with me here in studio. Thank you so much for making the time to join us here on News Center. Now, at the beginning of the pandemic, the worry was about the uptake, people's willingness to take this the coronavirus vaccine that had been, developed. But now we're facing similar issues, but now more on the supply side and some of the logistics. Could you explain to us what the situation is as far as the spread of the coronavirus is, and of course the antidote, which right at this point is only a vaccine? How are we doing on that level?
Thank you, Trix, for having me in the studios today. So you have asked me two questions.
Yes.
One is regarding what is the status of COVID-19 transmission in Kenya, and the other question is the COVID vaccine uptake in the country. Trix, since last year, we have seen 3 waves in this country.
Yeah.
And if you remember very well, about 2 months ago, experts had predicted that there will be a 4th wave in July.
Yes.
That doesn't seem to be happening because we only have like 1 week to end of July. This wave, basically, the prediction was that there will be a lot more people interacting in public gatherings. But more importantly is the new variant of COVID-19, the Delta variant, which is actually spreading faster within a population. If you look at the daily new infection numbers from May to now, it has been fluctuating from 300 per day to 800 to 600. We're not seeing like large number of people being reported positive, and we're also not seeing a large number of people being admitted in hospitals, in ICUs. So it means that we may not actually reach the 4th wave this month. Maybe
But then reports have indicated that we have climbed to 13.6% positivity rate. What does that mean if, in fact, you're saying that we are not headed towards another 4th wave? Another wave. Yeah.
If you look at the curve, I was looking at the curve yesterday.
Yes.
We seem to be at the lower plateau of the curve.
Okay.
But you know, waves are actually driven by 2 factors. The first factor is the virus itself, and the second factor is activities that encourage gathering of people in large numbers.
Super spreader events.
Yes. Now, with regard to the first factor, which is the virus itself, we have the Delta virus, which is actually more transmissible than the previous COVID-19 variants. So that can easily drive a wave. But the second factor, which is activities that encourage gatherings, remember, political gatherings are one of those super events that lead to transmission of COVID-19. And for now, those political activities, I think the government has banned them. If you go to western part of the Kenya, of this country, churches are not, people are not allowed to gather in churches. And so you look at these activities that would bring people together in large numbers, they are limited. And as such, it is like they are suppressing the wave from taking off the way it should have taken off.
Okay. Now, also there's the phenomena of variants. Every other time we hear about a new one. Could you explain to our viewers, first of all, how a variant comes about, and perhaps how it complicates the fight against, the coronavirus? Because now there's emerging reports that some vaccines might not actually fare very well in protecting people against variants such as the Delta variant.
Thank you very much. So how do these variants emerge from our populations?
Yes.
It is a very normal thing for a virus actually to mutate and change.
Yes.
This is purely because when a virus gets into your body produces arsenals. We call them immune response.
Yes.
To try to get rid of the virus. However, the virus also wants to survive. So in order to survive, they have to change to look differently from the previous one. And that is how you find a new variant has emerged.
Yeah.
Once that variant emerges, 2 things may happen actually. This new variant may behave like the previous virus, or it may behave differently.
Okay.
If we think about the Delta variant, for example, the Delta variant has now been shown to be twice as more transmissible compared to the previous COVID-19 variants.
Okay.
And it is actually causing a lot more disease in people than the other variants.
That means you get sicker than if you had the other one.
A lot more people are likely to get sicker with Delta virus compared to the other COVID variants.
So this means more people are likely to die off of this infection?
Yes, so if you are not vaccinated and you get Delta variant, you are likely to develop serious COVID disease. end up in ICU and probably die. So it's a very tricky variant of the COVID-19 virus.
Okay. So as far as protecting ourselves against this, are we doing well when it comes to that? Ensuring we're not taking it in from outside or even allowing it to spread further?
I've looked around, how do you get these variants? Number one, I think let's start from how do you protect yourself from getting the variant?
Yes.
If you ask me tricks today, almost every Kenyan is aware on how to protect themselves from getting, COVID-19 virus, any variant.
Yes.
One is by wearing masks, social distancing, washing your hands. All these things, we now know them. However, if you look around, take, for example, a matatu. If you look at people in a matatu, out of those who sit in a matatu, only some would actually be wearing the mask.
True.
Even those who are wearing the mask, a lot of them will put the mask on the chin. So when you put the mask on your chin, your nose and your mouth is breathing in and out.
Yeah.
If you are infected, you are likely to spread the virus to the people who are sitting next to you. If you are not infected, the person who is sitting next to you who is doing the same is likely to spread it to you. So I think we are not doing very well in terms of implementing these public health interventions that would help us to, either protect us from acquiring the virus,
yes,
or protect others from acquiring the virus from us.
Okay.
Yes.
Now let's get back to the issue of vaccination. How are we doing as a nation? We heard about those donations from Denmark that might be expiring at the end of this week. How does that sit with you as an expert in this field?
So if you look, let's start globally, Trix. I was looking at the data on global vaccination per se. China has vaccinated 1.5 billion of its population. 1.5 billion.
Yes.
If you come to Africa, we have actually vaccinated about 60 million. Out of these 60 million, Morocco actually leads by having vaccinated about 26 million, followed by South Africa. In Kenya, we have vaccinated 1.63 million, and out of this 1.63 million, only 600,000 have been fully vaccinated.
Yes.
So, meaning that if you're looking for people who are fully protected against these COVID-19 variants, is those 600,000 people. So we are not doing very well.
We are doing badly, actually.
We are doing very well.
Terribly.
Yes.
Yeah, compared to the rest of the world, functionally, then that means we are not vaccinated at all.
Compared to the rest of the world,
yeah,
if you look at the percentage of the population who has been vaccinated, we are about 2.3% of our population. Remember, you need to vaccinate about 60%. So how can we achieve this 60% maybe by the end of 2022? And
by gaining 60%, that means you have gotten the herd immunity, right?
Yes, by vaccinating about 60%, then you will have created that what we call herd immunity. So those who are vaccinated will now protect those who are not vaccinated.
Yes. So, like, when we look at those numbers that you're giving us, basically that means that depending on donations is not the best way to go about this issue. Of course, it's wonderful that other countries are going to be have been helping African countries and Kenya to be, in particular, to gain the vaccine doses that we need. But that's obviously not enough. And when you listen to the rhetoric around this issue and international health analysts, the thing is, nobody's coming to save Africa, so it means we need to be looking inward. What are the possibilities of this continent getting to a point in time where we can actually manufacture for ourselves our own vaccines and ensure that we are protecting ourselves without hoping that someone will actually come to the rescue of our masses? I know that South Africa has recently been approved to actually produce the Pfizer vaccine. What about Kenya? What about other countries that have considerable clout financially to actually make this happen?
So what you are saying, Trix, is very true. One of our challenges as a country in terms of getting enough doses of COVID-19 vaccines is the fact that we cannot manufacture these vaccines in this country. If you look at the beginning, when we made a decision to use AstraZeneca vaccine in this country,
yes,
we were relying on India. But remember, as soon as we got our first doses of vaccine from India, there was a surge of COVID-19 in India.
Right.
So the priority now changed. India could now not send us the vaccines and leave their people who are now getting infected with COVID-19. So now that brings us to the question, as a country, in future or even now, because COVID-19 is going to be with us for a long time, are we able to start manufacturing vaccines ourselves? I believe that one of the advantages that this country has, we have trained so many people in all fields. All we need is to create an environment and we will be manufacturing our own vaccines. So I think the government should take up this challenge and start thinking seriously. Instead of relying on other countries, can we make our own vaccines in this country to meet the demand for the vaccine that we require? Yes.
And when it comes to, of course, we have a lot of great professionals who can achieve this, but when it comes to the set protocols of that, could you explain to us what it takes for a country to get to a point where the WHO, let's say, has approved this vaccine for use? And also how long would that actually take?
So I think what you are trying to ask me is, what do we need to be able to start manufacturing vaccines?
Yes.
We will not be manufacturing, new vaccines which are coming to the market. All we are saying is that, do we have the ability to make the already existing vaccines?
Yes. Like
the Pfizer vaccine, AstraZeneca. Can we create the infrastructure to make these vaccines in this country? There is a very clear protocols. You must have facilities which have been inspected and are shown to produce safe vaccines. And I think these protocols are not rocket science to this country.
Yes.
We can easily develop them and then train the people who are going to make these vaccines, whom I believe we have a lot of people in this country who can be trained to do that.
Okay. Yes. And far from that, now that you've pointed out that we're not coming up with new, like the Kenyan, vaccine for the Kenyan people and whoever else would want to take it, but this is just, we would be manufacturing what has already been developed. At the same time, it brings to the fore the conversation about patents. Where are we with that?
So in terms of patents, I think this is, when somebody makes a new product, either a drug or, say, a vaccine, usually they want to protect this product in order to reap the resources.
For the sake of profits, right?
Yes.
Yes.
The resources that they put in developing this. So you can see that you are saying that South Africa has been allowed to manufacture Pfizer.
Yes.
It doesn't mean that South Africa now has the patent. The originator of this vaccine will still have the patent, but now they are extending, the ability to make more vaccines by spreading to other parts of the country. So the patents will still be maintained by Pfizer for the Pfizer vaccine.
Okay, yes. So it's sort of a franchise type of thing?
Something like that, yes.
Okay. Now, also, there was a lot of controversy surrounding the Tokyo Olympics. As you can see, it is ongoing right now, and the athletes are out there, and they're testing and ensuring that people are staying safe and not, doing their best to ensure that they're not mingling enough for this to be a super spreader event. But so much can be done, especially given the number of athletes that are going there, and they shall be going back to their respective countries, and the possibility of this virus spreading even from there continues. What do you say about that? And are you of the opinion that it should have been stopped, or is there hope that they can actually contain it with all the restrictions that have been put in place?
Yeah, the Tokyo Olympics tricks is one of those events that bring large number of people from across the globe together. And, such gatherings are likely to kind of spread this virus, COVID-19.
Yes.
I think it is very difficult to control COVID-19 100% in a gathering like what we are seeing in Tokyo.
Yeah.
There will be some element of spread. If you can imagine, if I'm a Kenyan athlete and I'm going to Japan, I start my journey from my village in Kisumu.
Yes.
I will interact with people along the way, up to all the way to Japan. I'm sure they are doing testing, of people there. But again, these people will go back to their countries. They will have interacted with a lot of people, and you could see. I think yesterday I was seeing that there's a surge of COVID-19 in Japan.
Yes.
And that surge will probably also include the people who are in the Olympics.
Yeah.
So, as much as you may put in stringent measures within the Olympic stadia, where these activities are taking place, remember, human beings are mobile. These people will go to shopping centers, they will go to other places, and still they're likely to acquire this virus and spread it to other people, either within Japan or in their own countries.
Okay.
Yes.
Now, all the factors put into consideration, how well are we doing as Kenya, back in the country? How well are we doing if you were to give it on a scale of 1 to 10? Where are we?
So when you
all
ask
things
me
considered, yeah.
where we are in terms of COVID-19?
Yes, containing it, adhering to some of the rules and regulations. How are we doing?
Let me start with, now we know that there's a vaccine
yes.
for COVID-19. And if you look at countries where they have actually vaccinated over 50% of the populations, you have seen that they have even, removed the issues like wearing of masks in public gatherings. Because they've been able to vaccinate their population. Now in Kenya, as I said earlier, we have only vaccinated like 2.3% of our population, which means that 97% of our population are unvaccinated. So that is very bad, given that we have this Delta virus circulating in our country.
Yes.
So we are doing very badly in terms of vaccination. That's number one. Number two, in terms of transmission, the transmission seems to be happening, but not at the level where it may lead to a wave at the moment.
Another wave, yeah.
Because if you look at the daily numbers which are being reported, of course there has been an increase in the number of new cases in the last 2 months, but these numbers are not as high as they should be to lead to a wave. The other thing is looking at the people who are being admitted in the hospital, because that's a very strong indicator that things are actually not working in the society. The ICU, I saw earlier, there are about 170 people in ICU.
Yeah.
That is not that bad. So I think that in terms of what the government has done to ensure that this virus is not spreading as fast as it should, we are doing, I would give them maybe 6 out of 10, but a lot more needs to be done in terms of vaccinating people,
yes,
ensuring that this virus doesn't spread in our population.
And streamlining the logistics that are required when it comes to, vaccinating the masses, because we cannot be hearing stories about expired vaccines, yet the country is at the little percentage you gave us earlier on. Thank you so much, Professor Julius Oyugi, for joining us this morning to bring us context to the situation concerning the spread of coronavirus and the efforts that are being made in the country and beyond to contain it. Now we're going to take a short break here on News Center. When you come back, we have more for you, including a story about stolen identity, and of course you don't want to miss this, because there's a lot to learn and about your identity, your data, and how perhaps you can protect it to ensure that you are not having things or rather